Welcome to Cyber Table Talks, where we dive into real world cyber incidents to uncover what went wrong, what we can learn, and how to stay secure. Today, we are covering a major ransomware attack that shocked the healthcare sector. The January 2025 breach at Frederick Health Medical Group, with nearly a million patients affected. This case is a prime example of why cybersecurity in healthcare is no longer an optional thing. So, what happened actually? On 27th of January 27th, 2025, Frederick Health Medical Group became the latest victim of ransomware attack. Hackers infiltrate their systems and expose the personal information of 9,34,000 patients. We're talking about social security numbers, driver's licenses, and confidential medical records, all compromised in a matter of hours. So, now the scope of your breach. This wasn't just a local IT issue. The scope was enormous. Like nearly 1 million individuals had their most sensitive data being exposed. The leaked information could easily lead to your identity theft, insurance fraud, and medical impersonation. Sources like NY Post, TechRadar, and Integrity 360 confirm the scale and severity of the breach. Okay. Now, how ransomware works? How this ransomware works actually? Let's break it down. Ransomware is typically deployed through phishing emails or infected attachments. Once clicked, it encrypts critical files and locks users out. The attackers then demand payment, often in cryptocurrency, okay, in exchange for decryption keys. If victims don't pay, that data is either destroyed or leaked publicly. So it's a really very, problematic. And cryptocurrency, if you pay in cryptocurrency, then it will be very difficult for you to track. Trace the like whom you are paying. So that is also another challenge is there. Now. Yeah, so like timeline of events, like on 27th of January, breach detected, immediate system lockdown to prevent further spread. Investigators were brought in, the public was notified, and patients were offered credit monitoring services. Okay. Now, why it matters? Why is this such a big deal? Definitely, it's a question. Healthcare organizations hold more than just financial data. They hold life critical informations. A breach can delay treatments, violate HIPAA regulations, Health Insurance Portability and Accountability Act, and put lives at risk. And in 2025, healthcare became one of the most targeted sectors by cyber criminals. Real world consequences. For patients, this could mean months, even years of damage control. Changing your ID numbers, battling fraud, and you're losing trust in medical providers. For Frederick Health, the your fallout includes your legal action, government scrutiny, and significant your reputational damage. Definitely. So that these are all real world consequences. Like, what are the immediate mitigation steps after the breach that swiftly this your Frederick Health took? Like, isolated the infected systems, launched forensic investigations, notified authorities and public, provided credit monitoring to affected patients. These are textbook incidents response steps, but unfortunately, they came after the damage was done. That is also true. Now, long-term security measures. So, what can healthcare organizations do to prevent this sort of things from this? Sort of incidents which, in near future, it should not happen. Enforce endpoint protection and network segmentation. Very important. Okay. Maintain offline backups that are regularly tested. Very important. Second, also conduct ongoing staff training and phishing awarenesses. Adapt a zero trust framework. Everywhere now it is being adapted. Okay. In security. Trust nothing. Verify everything. Okay. So to wrap up your final thoughts, this ransomware attack reminds us that in the healthcare, data is not just information, it's human life now. As patients, we must demand better protection. And as organizations, we must evolve our defenses. If you found this breakdown useful, don't forget to like, share, and subscribe the Cyber Table Talks for more real cyber case studies. So, until next time, stay cyber safe and stay aware also. Thank you. Bye for now.